Sitting, hospital ward. You have been called to the patient bedside. The patient was supposed to go in for surgery at 10 a.m. and he was on the second on the list. But the surgery was delayed because the previous patient had some complications during the surgery. Apparently, he has never taken anesthesia before and he was suffering from post-operative vomiting. He has not passed his urine and he is in terrible pain. The patient's daughter is very angry and wants to talk to you. Now, let's see the task. First one says, find out why the patient's daughter is angry. Second one says, empathize with the doctor about the delay but be realistic about how long the patient may have to wait. Third one says, explain why the surgery is late. Fourth one says, explain post-operative complications are unavoidable. Try not to blame theatre staff or doctors for the delay. The last one says, negotiate with doctor to prevent her from insisting her father is discharged. Now, let's start the role play. Hi, good morning. I'm Linda, one of the registered nurses working in this hospital ward. I heard you ringing the buzzer. How may I help you today? Then interlocutor may respond saying, yes nurse, it's me. As you know that, my father has been waiting for his surgery since yesterday evening. But it's getting delayed unnecessarily. I don't really understand what's going on here. Then responder saying, first of all, I sincerely apologize for the delay. I will explain you everything in detail. Before that, how should I address you for a better communication? Then interlocutor may respond saying, nurse, I'm Rose and he is my father. Then responder saying, okay Ms. Rose, unfortunately the patient who is currently in the operation theatre had some complications during the surgery. Additionally, he had never taken anesthesia before, so he has post-operative vomiting and has not passed his urinate. Moreover, he is in terrible pain. That is why your father's surgery is getting delayed. But I can assure you that your father will be shifted to the operation theatre within an hour. The interlocutor may respond to saying, no nurse, I'm really disappointed with your services. See, my father has been waiting for his surgery since yesterday. Moreover, the surgery was scheduled at 10 in the morning and it's 12 now. Apart from that, he has not taken any food since yesterday. It is really difficult for an old man like him to wait for such a long time for his surgery. I think he is extremely tired. How do you feel about the situation we are in? The responder saying, I completely understand the situation, Ms. Rose. Please set your mind at ease. As I told you before, there were some complications for the patient who is in the operation theatre, due to which your father's surgery is getting delayed. But do not panic. Your father is currently on intravenous fluids. That will certainly keep him hydrated. The doctors confirmed that the patient who is already there in the operation theatre has overcome his critical situation and his health is satisfactory. So I can assure you that your father will be shifted to the operation theatre within an hour. I hope you understand the situation. Then interlocutor may agree with that. The responder saying, thank you Ms. Rose for your kind cooperation. Please understand that these kinds of post-operative complications are really unavoidable. It can happen at any time and is completely unpredictable. In this case, we cannot blame the theatre staff or doctors for the delay. So I can reassure you that your father will be shifted to the operation theatre within an hour. Is it okay with you? Then interlocutor may respond saying, okay nurse, I agree with you. Please let me know how long we need to wait here to shift him to the operation theatre. I would also like to let you know that if the surgery gets delayed again, we will certainly get him discharged and shift him to some other hospital. Is it okay with you? Then responder saying, I'm really sorry to hear that, Miss Rose. I really understand how angry you are about the delay. Please understand, if you shift your father to some other hospital, he will get the same treatment there. Please be aware that he has already undergone his pre-operative procedures. If you shift him to some other hospital, he needs to undergo the same procedure again. So that will delay his surgery unnecessarily. On top of that, if his surgery delays again, it may lead to some other complications to his health. So in order to avoid these complications, I strongly recommend you to stay here in the hospital for 1 more hour so that we can shift him to the operation theatre and do his surgery successfully. I hope you understand the seriousness. Then interlocutor may agree with that. Then responder saying, I'm really glad to hear that, Ms. Rose. Do you have any more questions for me? Then interlocutor may respond to saying, nurse, my concern is my father's health. I do not have any other problems other than that. Then responder saying, I acknowledge your worries, Ms. Rose. I can assure you that we will be able to finish his surgery on time and he'll be perfectly fine. I hope I have clarified all your concerns and queries. If you have any more questions or concerns, you can just ring the buzzer. We'll be here to assist you. Once again, I assure you that your father will be shifted to the operation theatre shortly and his surgery will be done successfully and he will be alright sooner. Thank you, Miss Rose, for understanding the situation and cooperating with us. I wish your father a speedy recovery. Thank you guys. Our roleplay ends here.